Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What type of insulin is Soliqua? Soliqua 133 contains insulin glargine, a long-acting insulin. Soliqua also contains Lixisenatide, a glucagonlike peptide 1, GLP-1, agonist. Soliqua is a medicine used to treat type 2 diabetes in adults, and is used alongside diet and exercise to help control blood sugar, glucose. These medications are combined in a pen injector that is given subcutaneously, under the skin, once a day. Soliqua 133 contains insulin glargine 100 units per milliliter and Lixisenatide 33 micrograms per milliliter. Lixisenatide is a non-insulin type 2 diabetes medicine that starts working after you eat a meal. Insulin glargine is a long-acting, recombinant human insulin analog. This medicine is used for patients who are not meeting their A1C goals and are inadequately controlled on basal insulin, less than 60 units daily, Lixisenatide, or oral medications for type 2 diabetes such as metformin. Stop all other treatment with Lixisenatide or long-acting insulin before you start Soliqua 133. How long does a Soliqua pen last? One Soliqua pen will last between 5 and 20 days depending upon your dose. The Soliqua pen injector contains 100 units of insulin glargine per 1 milliliter. It also contains 33 micrograms of Lixisenatide per milliliter. Each Soliqua pen holds 3 milliliters, so there is a total of 300 units of insulin glargine per pen. The Soliqua 133 pen delivers 15 units to 60 units per injection. Soliqua 133 is not used for a dose of less than 15 units or more than 60 units per injection. For example, if your dose is 30 units once per day, your pen, which holds 300 units total, will last 10 days. You can use your Soliqua pen for 28 days after your first use. After that, dispose of the pen, throw away, even if it still contains some medicine. Use a new needle for each injection. Throw away the pen and needles in an FDA-approved sharps container. After your first use of Soliqua, store the pens at room temperature 77 F, 25 C. Is Soliqua a long-acting insulin? Yes, Soliqua contains the long-acting insulin glargine 100 units per milliliter, brand names examples, Lantus, Toujeo, Basaglar, and Lixisenatide 33 micrograms per milliliter, brand name example, Adlyxin, a glucagonlike peptide 1, GLP-1, agonist. You only inject Soliqua once a day. This medicine is used for patients inadequately controlled on basal insulin, less than 60 units daily, or Lixisenatide. You inject your dose once a day within 1 hour before your first meal of the day. Try to use your dose at the same time each day. Bottom line, Soliqua 133 contains insulin glargine, a long-acting insulin, and Lixisenatide, a glucagon-like peptide 1, GLP-1, agonist. Soliqua is a medicine used once daily, alongside diet and exercise, to help control blood sugar, glucose, in patients living with type 2 diabetes. Soliqua comes in a pen injector given subcutaneously, under the skin. This is not all the information you need to know about Soliqua 133 for safe and effective use. Review the full Soliqua 133 information here, and discuss this information with your doctor or other healthcare provider, RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.